Hey guys, I don't normally dress this nice, but I just came from a wedding and I really wanted to talk about brown spots on your teeth. Brown spots on your teeth suck, and yes, they are noticeable and they definitely make you not want to smile and show off those teeth as much. As a dentist, a lot of the times I just overlook this because usually people get used to it. And staining a lot of the time isn't really a disease, and most of the time it doesn't need any treatment. But aesthetic concerns are real, and sometimes we get people that want to fix up their smile or just get a new smile in general. So I'm hoping to prevent you from making the mistakes that a lot of other people do. I'm going to give you 7 things that cause brown spots to form on your teeth. Number 1 is tetracycline. Tetracycline is an antibiotic, and it was used a lot more in the 1950s. It's not really used as much anymore. But if it was used on you as a kid, then you're kind of out of luck because it's going to cause these brown spots to form and they don't really go away even with whitening. Your best bet if you really want to get rid of these stains would be some veneers or aesthetic crowns depending on your case. Number 2 is smoking stains or just using tobacco products in general. Smoking and using tobacco products leaves stains on your teeth. And once in a while these can be cleaned away at your dental cleaning because they can just polish it and get rid of it. But sometimes these stains can get deeper inside of your teeth and you need something more extensive like either whitening or again, in really severe cases, maybe some crowns or veneers if you really want to get rid of these stains. Number 3 is drinking coffee, tea, or wine. These are some of the drinks that can really stain your teeth. And obviously other drinks can stain your teeth as well, but these are probably the most common that you'll see staining. Now obviously I'm not going to tell you to completely avoid these drinks. I mean, some people can't even live without their coffee. But I will tell you to try to limit it as much as possible and you won't see as much staining. Now the good news is that these types of staining are really easy to get rid of with over-the-counter or even in-office whitening. And another thing you can do is to just rinse your mouth with water after having one of these drinks. Number 4 is tartar. This is why you go to your dental cleaning. Tartar is basically plaque that has gotten hardened and is now stuck to your teeth. What is plaque? Plaque is clusters of bacteria that are loosely attached to your teeth, and these can be cleaned away with your toothbrush and dental floss. But over time, this plaque in your mouth will start to mineralize with your saliva, and it'll start getting harder and harder, and it'll now be stuck to your teeth, and now you can no longer remove it with your toothbrush and floss. So now you have to go to the dentist and get it professionally removed. But the longer you wait, the more this tartar will build up on your teeth, and the more it'll show and the more you'll see these brown spots. Number 5 is dental fluorosis. Dental fluorosis is when you're exposed to too much fluoride as a kid. When your teeth are still developing, fluoride will start to incorporate with your teeth. Now normally fluoride is used to strengthen and remineralize your teeth, but as your teeth are developing, too much fluoride can get incorporated with your teeth and actually weaken them. And a lot of people have mild cases of fluorosis where you see these little white patches form on your teeth. But if it gets more severe, then you'll start to see these brown pitted spots form on your teeth. But if you're older than 8 years old, there's not much else you can do because your teeth are pretty much done developing, so there's really no more cause for concern. Number 6 is if you have a cavity. Now a lot of times when cavities are forming, they'll start to form as these white patches around your teeth. These white patches are basically part of your teeth that are demineralizing and are starting to get weaker. Now give it some time and these can start to form real cavities where they start to form a hole in your tooth, and at this point they can probably change color and turn brown as well. Number 7 and the last thing on my list is if you're grinding or clenching your teeth. Grinding and clenching your teeth will leave some marks on your teeth over time. These are called wear facets. And depending on whether you're grinding or clenching, these marks might look a little different. If you're grinding your teeth, you're basically gonna wear away those front teeth of yours and they're gonna start to get shorter. And as they get shorter, you're wearing away the top layer of your tooth, in other words, your enamel, and you're exposing that dentin underneath. So your teeth are gonna look more flat, and if you look at that flat edge of your teeth, you're gonna see a yellow or brown spot, and this is just that dentin that's exposed. And if you're clenching your teeth, you're probably gonna see spots more in your back teeth, but it's gonna be similar. You're gonna see these pitted brown spots because your enamel has worn away and you're exposing your dentin that's underneath. Thank you guys for watching. I hope you liked that video, and if you haven't already, please hit that thumbs up button and subscribe to my channel below, and I'll see you in the next video.